I'll quickly talk about the learning objectives as we are going into the central nervous system pharmacology. So the learning objectives is basically if a student wants to study central nervous system pharmacology, what are the things that they are actually expected to cover to know that they have actually acquired some good level of knowledge on central nervous system pharmacology. So this first you have to learn about the foundations of central nervous system pharmacology, okay, where you get to talk about how neurotransmission even occurs, okay, what are the different types of neurotransmitters, okay, and you should know about basic terms like agonists, antagonists, reuptake, enzyme inhibitors. I don't know if you understand. Then we also talk about neurotransmitter systems and drugs, where we get to talk about cholinergic systems, adrenergic systems, dopaminergic systems, serotonergic systems, GABAergic and glutamatergic. So talk about all of them and how drugs is able to modulate how a system is excited and also how a system is inhibited. Then therapeutic applications now. With the little knowledge you'll be getting, you now build up trying to learn about disease conditions that could affect the central nervous system and how drugs can be able to solve them. So just a little, we've learned about Parkinson's, epilepsy, Alzheimer's disease, multiple sclerosis, right? We'll also talk about, all the psychiatric issues like depression, anxiety, schizophrenia, bipolar disorder. So all of them, you understand, we get to talk about all of them, okay? Then we talk about those drugs. We also talk about their effects, their good effects, and also how to be safe around them because overuse or overdose could actually get into issues. Okay, I think at that level, that's what we also talk about the addiction and abuse that people usually abuse these drugs. Okay, then on your own, you can now do more research and all of that. Look at many disease conditions. Appreciate how these drugs are helping in modern research, okay, and all of that. So this is what we got.